Right. We're good?
Sorry to interrupt. We just need Osborne to stand here and apologise for the arrangements of the call. Thank you.
It's that way, so I can follow your questions. Thank you very much. Sure. Thanks very much.
Okay. And so where would people like me to look? Just straight down? Yep, okay. All right, good morning, everybody. I'm very pleased to be here, and I'm joined by Andrew Crisp, of course, the Emergency Management Commissioner. We also have, and it's great to see, Brigadier Burr, who is here from the Australian Defence Forces and his team. And also we are joined by Brett Sutton. And what I'll do in terms of the process, of course, of this doorstop is to go through an update on where we're up to in terms of the power outages, and also then move on to an announcement that we're making with respect to providing further support to those Victorians that remain off power supply until the 10th of July. Andrew Crisp will then make some comments with respect to those matters. Then we'll ask Brigadier Burr to make some comments. We'll take questions and answers at that point, and then, of course, we'll move to Brett Sutton to give his update. I'll just let that siren go. I can see the sound man saying yes. Good move. Okay. Okay. Now, overnight and into this morning, we now have just over 4,000 Victorians who remain off power supply as a result of that unprecedented storm event a few days ago, 64 of which are power dependent. AusNet services have advised that by the end of this weekend, of those 4,000 remaining off supply, they advise that 3,172 will be reconnected by the end of this weekend. Now, I always put a caveat on this because all going well, we know, of course, that we expect to see high winds coming through parts of the state, including the Dandenongs ranges, and of course, with that could be, of course, more trees coming over that are already vulnerable and weakened by the storm event, which could then, of course, impact other power lines. So I put a caveat on that. But all going well, that further 3,172 connections will be completed by the end of the weekend. Now, that leaves AusNet with an aspiration of having a further 186 connected by Friday next week, which leaves about 1,450 that will remain, unfortunately, off supply until the 10th of July. Before we go on to the new announcement that we're making to support those Victorians, I also want to give an update on the applications that we've received so far from Victorians who are eligible for the prolonged power outage program. That is that payment that the Acting Premier announced a couple of days ago for a flat $1,680 of payment for households who remain off supply from the end of Wednesday night past when the announcement was made. And AusNet services have reported to me that they have thus far, in the very short time that they've been open, have already approved and validated 100 applications, and those payments will be being received by those Victorians very soon. So that is really good news. What I do encourage every Victorian that is eligible for this payment is you don't have to wait for AusNet services to send you a text message. That is a backstop for those people who may not be able to get to their website, but you can get on their website anytime right now, fill in the application form. AusNet services teams are ready to go through the validations of that, and they will do that as quickly as possible, and you will be able to know very quickly whether you will be receiving that payment. So, of course, that is a really important way for people to just get online, get that application filled out. As soon as you can do that, and once it's validated, you'll be able to receive your payments through electronic funds transfer very, very soon afterwards. That, of course, requires a banking processing part of it. So we just, I think Victorians are very familiar with that, but certainly monies will flow as soon as possible. For those, as a backstop, as I said, AusNet Services are also sending text messages to Victorians that are eligible, just as a backstop again, so that we have no gaps in terms of the information being available to those who need this payment. I also want to move to what we are going to be announcing today. We know that there is still going to be quite a number of Victorians that are going to be off power supply until the 10th of July. What I'm absolutely pleased to be able to announce today is that we're making 200 small generators available to those Victorians who will be off supply till the 10th of July and are still living in their homes. What is important here, of course, is...
Thanks, Minister, and good morning all. I might actually take the opportunity to go through the coronavirus situation update for Victoria, and then I'll come to that question. So we've had a single community case today. That case lives in the same household as an existing case from the Arcare Maidstone outbreak, and so that brings the overall number of cases in that particular outbreak to 13. That individual's been in quarantine throughout his infectious period, so no new exposure sites, and obviously demonstrates the benefits of that quarantine for primary close contacts. There's been terrific progress made across all outbreaks thus far, and thousands of primary close contacts cleared across all of the outbreaks that we've got within the overall Kappa and Delta outbreaks. Genomic testing results on the nurse from the Epping Private showed the Kappa variant in that case, and obviously we already had the epidemiological link to Arcare Maidstone, so that clarifies and supports that link. Testing of primary close contacts for the Epping Private Hospital case continues, and the majority of tests are already in and delivering negative results. So there are 11 staff members at that hospital identified as Tier 1 primary close contacts, all quarantining for 14 days, and 10 already returned negative results. All other staff have been tested and can return to work only after receiving that negative result. At the Northern Hospital, 67 people have been identified as primary close contacts, and 55 have already returned negative results. At the Northern Health Immunisation Clinic, all staff have returned negative results, and around half of 55 patients have also been tested and are negative. The total number of positive COVID-19 cases linked to the South Bank outbreak still stands at 9. All 22 residents who live in close proximity to the 9 positive cases there have been tested at least once and returned negative results. They are being asked to test every 2 days because they're in that close proximity while they undertake their 14 days of quarantine. There are 168 other residents identified in the wider Kings Park South Bank complex, and 154 of those have returned negative results. They're midway through their quarantine period and will be tested again this weekend. Our public health team's been out on the ground monitoring the situation and assisting residents with all of the practical requirements of ground support. Those residents have been incredibly patient. It is incredibly difficult to be stuck in your home en masse, and my thanks go to them very much for their patience with all of the response supports in place for them. Obviously, we're closely monitoring the situation in New South Wales. I understand there's an update there this morning. We did make the decision on Thursday evening to designate Woollahra, Waverley and City of Sydney local government areas as orange zones from the 11th of June under Victoria's travel permit system. So that's a requirement for people to, in coming back to Victoria, test, isolate until they get a negative result. Permit checks are in place at our airports, including Bendigo and Mildura. If you are from these areas in New South Wales, visit the Service Victoria website and get an orange zone permit before travelling. And as I say, you'll be asked to isolate and test. But all arrivals into Victoria must apply for a travel permit, even if coming from a green zone, and any further updates to travel permit requirements will be based on public health advice as the situation unfolds. Vaccinations are obviously front of mind for us at the moment. We did record a pretty good figure yesterday, 17,800 vaccinations. So the total number from State Commission Services now at 886,507. Getting vaccinated remains the key to getting through this pandemic, and the demands in Victoria are really great to see. So good on everyone for continuing to roll up their sleeves and get vaccinated. We've had more than 1.83 million doses delivered in Victoria in total, and we thank everyone who's come forward to be vaccinated. Right now, 27% of Victorians in the 40 to 49 age group have had at least one dose, 45% of those aged 50 to 59, and 65% for those aged 70 plus. If you've had your first dose, it's critically important to make plans for the second. Pfizer doses, the second dose is recommended between 3 and 6 weeks, and for AstraZeneca, you should get your second dose at 12 weeks. I've booked in for my second dose for July. One dose is not sufficient protection, either for the Pfizer vaccine or for the AstraZeneca vaccine. So please book in and get your second dose for that, as full protection as you can get from vaccination. We've had bookings reserved for second doses so that everyone who books in for a first dose can get their second dose. New bookings for Pfizer first dose will open up from next week. There's obviously been a lot of discussion about AstraZeneca over the last 24 hours with new ATAGI advice and the statement that they released advising that Pfizer is now the preferred, not the only vaccine, but the preferred vaccine over AstraZeneca for people aged under 60 years. The advice is clear, however. If you've received your first dose of AstraZeneca without any serious adverse reactions, you really must get your second dose at 12 weeks. If you've got concerns, please speak to your GP, please speak to a qualified health practitioner so you can talk through any and all of those concerns that you might have. The reality is that the already very rare risk of clotting disorders from a single dose of AstraZeneca vaccine is even rarer with a follow-up dose. And that's, one of the reasons that I'm entirely comfortable booking in for my second dose. There were 2,000 Victorians who received the first dose of AstraZeneca vaccine yesterday, so we're continuing to see demand for both of those vaccines. We want that to continue. And finally, as restrictions ease this weekend, a reminder the virus is absolutely still out there. As you get out and about a little bit more, including into regional areas, please remember to follow those directions that apply across Victoria. Please use your mask indoors and when you can't physically distance, and check in with QR codes wherever you go. It does mean that we can directly contact people. We've done it with Port Melbourne and South Melbourne in particular in the last week, and the automated messaging from that QR code data can get out to thousands of people, as it has, which is one of the reasons why we're still getting testing at the 30,000 level today and in recent days. And of course it helps our contact tracing team do their very important work if they can identify people. So please be COVID safe this weekend. On the issue of crowds in Geelong, I did note that as well. Obviously people are in a zoned area. One of the reasons why we limit the numbers is the overall number of interactions that people can have by having that limit to 7,000. People still in their bookings will gather and sit together as they're free to do so. There was still spacing between groups of people, and my understanding is it's easier to oversee compliance with that kind of spacing if they're within a zone that the officers can manage. That said, I'll go back to the team and really understand if there's greater spacing across more zones. But the really key management of risk is the spacing between groups and making sure that people aren't moving around, getting up from their seats more than is required, and obviously that overall cap on numbers. And I think from a ticketing point of view, the cap on numbers is more easily managed if they can manage within a zone, but happy to go back to the team to really understand that.
But Professor, from a layman's point of view, if you've got 7,000 people there basically all in one zone, what's the difference then having 2 or 3 groups of 7,000 all on the same
Well,
zone?
it's the overall number of people who are there and interacting in close proximity to each other as booking groups. And so that's capped at 7,000 for now. We will obviously review that and I'm sure that it'll go up in numbers over time. But that's to manage the overall risk by the cumulative effect of people being in close contact, gathering together.
What do you mean by that? Is that like public transport coming into the ground, that sort of stuff?
Yeah, so the ingress and egress into the ground is one of those factors, and the public transport element is obviously a factor as well.
For stadiums, it seems to be a cost thing, though. They only have to open a portion of the stadium. Do you think as we start to open up with Marvel, MCG, hopefully, that there should be rules about zones instead of those scenes where we just see them all packed together on one side?
Yeah, look, I think as we open up and there are bigger crowds, those zones will fill. To begin with, I think I need to get an understanding from the operational side from those stadia exactly what the issues are with them. But I think clearly we want people separated, but we also want the compliance and enforcement for people not moving around and between zones, as well as the soft subzones within those.
Who sets the rules at the moment? Is it the stadiums themselves?
So there's an ongoing piece of work between our public health assessment panel and the stadia, really around how all of that can work and to make sure that we're satisfied with the arrangements that are in place. But they need to tell us what their operational conditions and constraints are, what they can practically manage, what it means from ticketing purposes, and what it means for contact tracing purposes.
I guess what I mean from that is it approved by the public health team, or is it there's just a guide?
No, there's an approval with a plan that's agreed with those stadia and organisations.
Just on those hospital negative tests, how much comfort can Victorians take from that when we've had quite a few day 13 positives?
So people may still turn positive, that's for sure, but it's very reassuring to get a negative test knowing that people have been in quarantine for the period up until that negative test. That means there are no new exposures. But those individuals will remain in quarantine as primary close contacts for the full 14 days. They may test positive on day 13, as we've seen for primary close contacts. But like today's case, getting a positive test on your day 13 when you've been in quarantine that whole time, unfortunate for the individual, they've then got to have their period of isolation, but no public health risk.
Just with the footy crowds, do you think it's sort of double standards given that there's no spectators allowed at local footy matches and the parents are missing out?
Look, we will work to have that in place as soon as we possibly can. A single event with 7,000 people is different from allowing across the state hundreds of people in groups in hundreds of locations, which could amount to tens of thousands of individuals. We will continue to assess the situation. It's looking pretty good in Victoria at the moment, and so I would hope again we're only 36 hours into the easing of restrictions in this period, but again that we can look through this week and see where we can get to.
Are we still looking at that? It's almost like a sort of a ritual on the Wednesday or Thursday changing. Are you looking at that being the time frame, or could we say over the next couple of days, if numbers continue to improve, that there could be changes virtually straight away?
No, look, I really do think we need that period of days to make an assessment when we've only just made a decision. We need to see the effect of that. So we'll work to that, weekly period of change, but the reviews do happen every day. And so, it's not without possibility that we can, make adjustments right through that period.
The reason for asking that question, obviously, is the AFL needs to plan ahead. So
of course,
it needs to look at next weekend. So from what you're saying, unlikely to be a decision before Wednesday or Thursday, so we're unlikely to get crowds of footy next weekend.
Well, the Public Health Assessment Panel make their determinations around public events as a separate element to the overall restrictions. So they will be in conversations with the AFL and others over some of those public events, and advice can come through the course of this week as well on that.
Are you optimistic for that?
I'm optimistic that we're on the right track for more things to be able to take place in coming days, for sure.
We've seen the Prime Minister today talking again about a potential traffic light system and a slow opening up, dependent on health advice from the AHPPC. Do you see that as there's the benchmark we need to get to as something based on vaccines, or is it more consistent days without cases that would see us be able to open up? And what level of vaccination are we sort of looking for to have a bubble with Singapore?
Yeah, look, they're really different issues. For us to come out of this, it's about new exposure sites or lack thereof, which is what we're seeing, and not having new cases emerge that aren't in quarantine or cases where we don't know where they've acquired it. For bubbles with Singapore, we've got a high standard with New Zealand at the moment. We really need to have no community transmission there, and in Australia for that to be enabled. Singapore is still struggling with their Delta variant. They've got low numbers of cases, but we don't want a single case imported into Australia there. So that does require Singapore getting to a really, really low zero level in their jurisdiction, and for us to maintain ours, get to it and maintain it in Australia. That will be absolutely supported by high vaccination levels. It's not only protection from widespread transmission, but it's going to make little outbreaks less likely as those cases that might come out of hotel quarantine interact with fully vaccinated individuals and the virus doesn't go any further.
Singapore has quite a high vaccination rate compared to us. Almost 25% of people have had both. Would you be looking for their rate to be even higher for a bubble to potentially open up? And what does that mean for our even lower rate?
Look, it's a decision for National Cabinet essentially to establish a bubble with Singapore, but Singapore need to drive down their existing cases. They've only got, 5 or 10 per day, but it is of the Delta variant. They've been struggling with it since late April when they got the beginning of that outbreak. That does, to me, remind us all again that it's a massive challenge with these new variants of concern. They are twice as infectious as the virus that we saw last year. And it's massively challenging, even with restrictions in place and with their significant 2-dose vaccination coverage in Singapore. They haven't gotten over it, and it does make me, again, very proud of, and we're not through it here in Victoria, it does make me very proud of being able to drive down as much as we have to date.
On that, New South Wales' approach, clearly, and a lot has been made of the difference. They've got the Delta variant, they've got 2 cases today, which are probably the Delta variant. When you look at the way they're handling it and the way we're handling it, can you understand why the people of Melbourne are saying, well, they're much more free and they seem to be handling it?
Well, I think too much has been made of difference. I think it's been overplayed, the difference with New South Wales and Victoria. We had the Blackrock outbreak where we didn't have a circuit breaker or a lockdown, and we managed that right through. That was the Alpha variant, as I recall. We had cases that occurred with community exposures through the Australian Open that were managed in just that way. We had our Wallet case initially from South Australia that was managed in just that way. But when you get to a case that emerges where actually you realise that it's a mystery case, that there's been multiple generations of transmission prior to it, and an explosion in cases over the first few days, which is exactly what's happened with our current outbreak, and then to see the Delta variant emerge in the middle of it, that's a different situation. And we had several thousand primary close contacts to manage, and we had hundreds of exposure sites with potential transmission. If we have a case that we can prospectively follow their primary close contacts, we know where it's come from, we know they're the first case in the introduction of the virus into the community, as is the case in New South Wales, we would go about it differently. That's not what we confronted here in Victoria with a case coming out of South Australia and then emerging as a mystery case.
So when you hear the New South Wales Premier say we're handling this in the New South Wales way, which is no lockdowns, how do you react to that?
Well, I'm not here to comment on other jurisdictions' approaches. They are free, as they should be, to manage it as they see fit. I'm just talking to the differences in epidemiology with the current outbreak that we're managing in Victoria and how we've similarly managed, in the New South Wales way, if you like, other cases and outbreaks in Victoria earlier.
Is that what people should be looking at going forward as an indicator that there may or may not be a lockdown if there is another outbreak? The exposure sites and the number of close contacts that are in isolation, rather than the number of cases?
Oh, look, I think it's a combination of them. Certainly that's a feature and is a big part of my public health team's deliberations. But again, the challenge of finding a case in the community where you've got no idea where it's come from and how long there might have been transmission out in the community is hugely concerning. And the reality is the Delta variant, now predominant in the UK, more than 90%, by the end of the month will be almost the majority in Europe. In another month might be the majority in North America. If we get other transmissions out of hotel quarantine, it's going to be the Delta variant. It'll be a very challenging virus. And if you suddenly see a case and you have no idea where it's come from, you have to have consideration that there are multiple cases, very infectious cases out in the community that might lead to dozens or hundreds of exposure sites in a very short period of time. But contact tracing remains the absolute core of the response here, and that's what's managing the tail end of this outbreak. It's certainly what managed the heavy lifting in the early part as well, but it is not the whole story. As I've said before, contact tracing can't do magic. If there are dozens of positive cases, if there are 10 each day, and they each go to 100 exposure sites, that becomes hugely challenging to manage, no matter you've got the best contact tracing system in the world.
Has there been a hesitancy to put a figure around what level of vaccinations we would accept to be able to get that lower than looking for 0 cases? The UK, which you just spoke about, have actually made that decision. They are opening up in some way, even though they're willing to accept it. How close are we to, I guess, even putting a benchmark on that, whatever that should be, to actually announcing a certain level which we're willing to accept in the community and what that vaccination rate would be?
Look, I think we're trying to work to it, for sure. There are modellers who are working on that and advising the federal government and AHPPC. It hasn't landed. It does get affected by what our vaccine uptake ultimately can be achieved. The vaccines that get registered and for what age groups in Australia, and the new variants of concern that emerge that can either evade the immune response from vaccination or can be more transmissible, like the Delta variant. So I'm sure we'll move to a figure, but we are in a different situation. I'm not sure Australians would tolerate the 128,000 deaths that the UK has been through. They are opening up because they have driven those new daily deaths down almost to single figures, and so they are moving through that. That said, they've got another challenge with the Delta variant, hospitalisations increasing and case numbers going above 10,000 again. So it's always a dynamic situation, and we'll try and clarify nationally, I'm sure, the kind of levels that would give us some assurance about that, but we're not there yet.
Professor, there was a bit of anger about your recent work trip to Canberra recently. What's your reaction to that?
I went for work purposes. It's a 2-day meeting of the National Health and Medical Research Council. We were all asked to attend in person if we possibly could, and that's because it's the end of a triennium, 3-year period where Council is reflecting on the work of that 3 years, is making decisions around significant funding priorities for medical research and looking at the strategic forward plan. Every day I come here, I go beyond 25 kilometres for work purposes. And there was an event held between those 2 days that was to honour medical researchers. No one zoomed in for that. You can't really honour people for their fantastic research without being there in person, as was Minister Hunt, as were many other Victorians, in order to honour those researchers who frankly have been through probably the toughest 12 months of trying to do research with all of the restrictions in Victoria in particular. So I was very happy to honour them. I was disappointed that the focus was on my trip and not on the purpose of NHMRC coming together and the fantastic research work that's been done.
Can you understand the frustration, though, of the people in Melbourne who are locked down, and they mightn't necessarily understand the importance of your trip, but they do look at you and they say, well, he's gone to Canberra, he's keeping us locked down. Can you understand that frustration?
Yeah, I can understand that frustration. I'm also subject to restrictions. I haven't seen my family over the last month because no visits to home. I lost power for 4 days and we toughed it out at home without power to try and limit, interactions with other people, and not moving house with others because we could tough it out. But yes, I can see that everyone's frustrated by the restrictions that are in place, but I'm trying to follow those restrictions to the fullest extent I can as well.
Other Chief Health Officers did zoom in, so did you consider that as we were moving closer to this event and we were still in lockdown? Was it ever a consideration that perhaps you just don't go?
Yeah, it was, and as I say, there was a great desire from NHMRC for us to attend face-to-face. I can understand why WA and Northern Territory didn't. They lose a day on either side, essentially, from travel. But others were present, and I continued to work on the COVID response right through that working day with NHMRC. Emails, I got on the call with ATAGI around their new advice and continued to engage on the COVID response. And there were important discussions on the COVID response and how we can strengthen our planning and preparation and data sharing in particular going forward. So, a lot of the council members reflected on how important it was for us to be in the room together. But, maybe if I could have my time again, I was disappointed that the distraction was about me and not about that important meeting that, as you know, Minister Hunt said was a really important meeting and it was appropriate for us to be there in person.
So if you had your time again, you would not go?
Oh, because of the way that it distracted from really the important conversations we should be having about the challenge of the current Delta outbreak in Sydney and our ongoing challenges here in Victoria.
Minister, just a couple of questions for you on a separate issue, if you wouldn't mind. There's been a story today about a lack of public hospital beds. I'm just wondering, is it acceptable these mental health hubs that were meant to be in place 2 years ago still aren't?
Well, look, these mental health hubs are being worked on right now and as quickly as possible. I mean, we've had a very trying time, certainly with COVID, that has put many restrictions in place right across the economy, and construction, of course, has been one of those. So we're working as quickly as we possibly can to roll out what is a part of an unprecedented package of support for mental health and related matters for Victorians. So we will continue to assist Victorians who are in need in the ways that are available now, and we will diligently and as quickly as possible get those projects completed.
But is it fair to blame that on construction when they should have been in place 2 years ago before these restrictions?
We're working as quickly as we can. There have been very many challenging situations that we are all very well accustomed to, unfortunately, as a result of COVID. And what I can say to every Victorian that is in need, there are a variety of supports that are available, but importantly, the move is as quickly as possible to get these precincts and these hubs completed as soon as possible. We are wasting no day to make sure that that happens.
The issue is not just with the infrastructure, it's with the staff, and they could have been hired despite the ongoing stoush with the union. Why hasn't that happened?
Look, the two things are related. You need hubs to be built, you need staff to be employed and available, and those two things come together.
But that's not what the documents say. They say that those staff should have been hired and adding to capacity on general wards until these hubs were ready.
As I said to you, we are working as quickly as we can to have these 6 specialist hubs constructed and ready for Victorians to be able to use them.
But the staff could have been hired.
As I said, we're working as quickly as we can to have all of the components of the support services available to Victorians.
Is the hiring process something that's going to be addressed soon?
Well, look, this is not a matter that I can comment on directly in that detail that you're seeking, but certainly happy to seek further information and provide that to you.
And can I just ask Mr. Sutton, Professor Sutton, one further question?
He's fine.
Is it frustrating for you that we may never know the source of the Delta outbreak because CCTV has apparently been eradicated by Alfred Health? Is that frustrating for you?
I don't know that would have necessarily had the answer for us because you can't see the virus, you don't know where transmission might have occurred. It would always help to know so that you can address a particular gap. No particular gap has been found, but clearly transmission's occurred. So of course it would be helpful to know so that we can put whatever other risk mitigations in place that might prevent this in future.
And given school holidays start next week, in a few days, would you advise Victorians at this stage not to travel to Sydney?
Look, those orange zone areas are of concern. That's why they're orange zone areas. People need to make their own decisions and assessments of risk and what it would mean for them. But as we've seen across Australia, there are circumstances where transmission's occurring in a region. It can go from nothing to red. It can go from nothing to orange to red pretty quickly, and that does mean that you get stuck in quarantine as a returning Victorian resident. That risk remains for especially those local government areas of Wallara, Waverley and City of Sydney at the moment.
Last question.
That might be it.
Yeah.
Thanks all.
Might be it.
Thank you.
Thanks, everyone.
Thank you. Good time.